You talk about, when you said recipient, it sounded like an award in my ears, but right now, well, that's the national perspective that we've looked at. One of the challenges is how the states will be taking on board this process and domesticating it in their various states. We have the Commissioner for Health in one of the states with us this morning. Dr. Tomi Coker is Commissioner for Health in Ogun State. She joins us virtually. Thank you so much for joining us this morning, Dr. Coker. So, the question one would want to ask gentlemen. You. Good morning. So, one of the questions that might naturally come first is, so it has started, chicken coming to roost, so to speak. How ready, how prepared would you say states are to take on this process?
Thank you very much for that question. I believe that every single state in Nigeria, 36 plus the FCT, we're all ready as commissioners to receive our, batch of vaccines. We've been undergoing a lot of training. On Thursday last week, we met with the Minister of Health in Abuja to discuss the deployment, as well as the Executive Director for the Nigeria Primary Healthcare Development Agency. And there is a well thought out plan that's been rolled out in all the states. The health workers are undergoing training, particularly in Ogun State. Today and tomorrow is about training the health workers that will actually administer the vaccines. We also have done a gap analysis of our cold chain in our various states. I can speak for Ogun State, certainly. We've looked from the state level, looking at our walk-in cold room. If it's functional, we've serviced it to ensure that it doesn't break down. Then at the LGA levels, we've looked at our deep freezers and ice-lined refrigerators, making sure that they're functioning optimally, servicing the ones that need servicing, repairing solar system and inverters. And at the ward level, which is at the delivery level, the facilities which are going to administer the vaccines, we have what we call solar direct drive freezers that would actually ensure that the integrity of the vaccines are maintained from the national level right through to the point of delivery. The last thing is the logistics. That is being taken care of by our development partners to ensure that there is a seamless logistics. I've just heard you talking about vaccine hesitancy. I think the major part for us right now is ensuring that we create demand by advocacy to religious leaders and influential people in our communities, because as one of my colleagues said, a lot of people are still skeptical about, is COVID real and is the vaccine safe? And we have to continue through media platforms like yours to send the message out that it is safe. The technology in the AstraZeneca vaccine itself is being used. It's being used for the flu vaccine, which is given every year in England. It's being used in TB and even the Ebola vaccine. This is the technology that was used. So I think the citizens of Nigeria should be rest assured that we as a nation were well prepared, and the government has done their part. The scientists have done their part by producing the vaccines. It is our turn to play our part in making sure we get rid of the COVID-19 in our society at large.
Yeah, well, you talked about the logistics, and there's a good question coming right, on that one, talking about capacity and all of that. But that we'll take on after this break. Just stay with us. Dr. Coker, thanks again for staying with us. One of the questions you have said that there is a high level of readiness in Ogun State, and you mentioned the issue of logistics the other time. With 3.92 million vaccines in the country, 36 states with the FCT. Question is, how many are you expecting in Ogun State?
Well, at this point in time, we don't know the exact number, but if you do the calculation, 3.924 million doses and 36 plus one state, and the number of health workers. What we have to remember is this first dose is for frontline health workers. I'm not sure, I doubt if we have 3.9 million health workers in Nigeria. So I'm rest assured that we have more than enough for the phase 1 eligible people that we're meant to be immunizing.
Well, the natural question that will follow that one would be, when then are we expecting the sequel?
Well, you'll know that the entire dose is not just from the COVAX team. There's also the African Union, and the anticipated delivery time for the African Union or the next batch of vaccine is probably March, which is where we are, March, April. So we should hopefully be receiving another batch of vaccines from the information that is coming from Abuja.
Whatever the number each state receives, it's 2 jabs to one person. Isn't that correct? So one is wondering, how far-reaching can it be?
If you know very well, it's a 2-dose vaccine, which is 12 weeks apart. So this first dose of 3.924 million is actually a single dose. It should cover 3.9 million, almost 4 million people. By the time the next dose is ready, is due, then we will have another set of vaccines. Hopefully it would have been delivered to Nigeria. So I have no doubt that in 3 months' time, we would have had another delivery of vaccines to the country.
Well, one of the ways that we understand the government is tackling vaccine hesitancy is for health workers and then strategic leaders to take the vaccines in public glare, so to speak. So what's the plan in Ogun State?
Well, like every other state, His Excellency Prince Abiodun, who's the governor of Ogun State, will be the first citizen of Ogun State to receive the vaccine. Then we would have strategic leaders as well as health workers. At the moment, we have 107 vaccination sites all prepared, and we have 138 teams of vaccinators who we hope will do at least 50 shots of vaccines per team a day. So that's the way we hope to roll it out. There will be a flag off ceremony just like the one we saw on Saturday nationally, where His Excellency, the President of Nigeria and the Vice President, both were seen receiving their vaccines. So there will be a similar ceremony in Ogun State, albeit a smaller version.
Well, I mean, it's good to know that the governor of the state is providing strategic leadership, which has been said to be vital in this whole rollout process. But speaking about logistics, because we know that's going to be a huge issue. In fact, you've heard the PTF time and again saying that, well, some states might not receive if they don't have their I's dotted and their T's crossed. So for Ogun State, can you just, if you could, walk us through the process you have put in place from the moment it is received from the federal government to the moment it gets to the recipient, maybe transportation, cold room storage. Just walk us through so Nigerians can have a mental picture of just what is involved in this.
Okay, thank you for that question. First of all, the vaccine is being stored in a cold room, a large cold room in Abuja. And these vaccines will be sent to various states where they have airports. They'll be flown there. From those points, there'll be ground sort of transportation to states like Ogun State, where we don't have an airport. There'll be ground transportation, and these vaccines will be kept in refrigerated temperatures between +2 and +8 to ensure their integrity. when they do get, and they will be escorted by security because this is a highly valued commodity. And when they get to Ogun State, they will be stored in a walk-in cold room, which every state is expected to have. Given that we do we vaccinate 4 times a year, we do routine vaccination on our children. So most states have this walk-in cold room. Then from the states, the vaccines will be deployed to the local government level. And there, they will be stored in deep freezers and ice-lined refrigerators to keep the temperature. From those LGAs, which we have 20 in Ogun State, they then go into the 236 wards. At those wards, you have what you call direct drive refrigerators, solar direct drive refrigerators. They are powered by solar panels, and these have been provided by UNICEF. And for Ogun State, we have 236 wards. We have 237 solar direct drive freezers, and the UNICEF keeps supplying. We still have 100 to be delivered. So we have more than enough capacity when it comes to maintaining the cold chain and ensuring the potency of the vaccines to the point of delivery. So those 236 primary health centers will be one of the vaccination sites that we will be using. We'll also be using secondary facilities and tertiary facilities. We've included the private sector as well in Ogun State because, as we all know, 70% of the citizens of Nigeria actually get their care from the private sector. There won't be any charges. It's just making sure that there's accessibility to the vaccine throughout the state for every citizen. So that's the logistics in Ogun State.
Right. I mean, that sounds like a plan, but what will be vital to that plan is funding. I think you've alluded to that. And over the weekend, there was this back and forth about just how much it will cost for transportation. There were some reports that it will be 10 billion, even though the head of the MPHCDA says, well, that's quite ridiculous. Maybe £1 billion naira or less. He was quoted as saying that. So for Ogun State, how much has been budgeted for this whole process? How much will it cost, and how much support are you getting from the private sector, which you referenced earlier on?
The truth is the financing is coming from the development partners like WHO, UNICEF, and they have funded the logistics up to what you call the last mile being the ward level. So all we have to worry about is just the consumables at the ward level. Of course, in every state budget, there is an allocation for COVID response, and this is definitely one of those responses. But I don't think the financial demand will be crippling as one would anticipate, because the development partners, as I said, WHO has taken it upon themselves to fund the logistics.
Right. So just like how much is the state government putting into this?
Well, as I've said, this is a pilot. This is phase 1. So it's almost like a recce. The funding is not going to be that elaborate because you are given the vaccines, you're administering the vaccines to health workers who will present themselves to health facilities. So I don't anticipate that would cost us more than the cost of cotton wool and needles and syringes. And altogether, we'll probably have 20,000 health workers in Ogun State, plus the strategic leaders. So I can't put a figure to it at the moment because, as I said, the vaccines have not arrived and the commodities required are not of that great expense.
To be clear, also, I know there were talks about some states planning to procure their vaccines and some from some manufacturers and all that. Does Ogun State plan to do such, just to augment what is coming from Gavi and other partners?
At this point in time, we have about 58 million vaccine doses from what information I have got so far coming into Nigeria. So I do not anticipate for the first and second phase that we will need to supplement the amount of, to buy more vaccines. Or maybe when we're getting to the third and fourth phase, when we've done an appraisal of the requirements. As you know, there is an electronic register where people have been asked to register their interest in receiving the vaccine. We have a lot of people that live in the rural area in Ogun State, and we do know there's vaccine hesitancy. Even in America, only 50% of the eligible people have actually come out to receive the vaccine. So I'm anticipating that in Nigeria, we may also have that hesitancy. So we have to continue to do a lot of advocacy. At this point in time, Ogun State is not planning to buy additional vaccines, just to answer your question.
Well, Dr. Coker, according to the National Primary Healthcare Development Agency, the estimated budget for rollout of COVID-19 vaccines end-to-end, including PPEs, transport logistics, and all of that for Ogun State is put at something in the region of 357 million naira. Can you confirm that?
I don't have that information at hand.
Okay, well, you talked about the challenge of communicating to the locals, and that is quite critical, because at the end of the day, if they themselves if they are not open to it, if they are not, if they do not welcome it, then there is a challenge right there on our hands. So there is also the talk, about some recompense, so to speak, for those who react contrarily to the vaccines. Is there any plan, any such thinking or plan for such in Ogun State?
Well, whenever you're running a vaccination program, you actually have to have medical equipment to deal with the adverse effects, EpiPen and all that. And so adverse reactions are, they're uncommon, but we have to be prepared for it. We also have been engaging the media. I've been on TV for the last couple of weeks, and the members of my team on local TV as I'm speaking as well, actually addressing the fears of people. The fears are real and they need to be addressed so that we can convince them that it is for the good of all. Yes, if you look at the figures in Ogun State, we have fortunately not suffered as much mortality as other states and what we see in other countries. In total, we've had 47 mortalities recorded. So it might be a hard job convincing people, but what we need to convince them about is the fact that this is for the good of all. If the virus keeps circulating in Africa, it can mutate. So we're working against time. The sooner we get the vaccine, the better. Because if the virus mutates, then we're back to square one. And the virus could be imported back to the Western world where they have managed to vaccinate their own people. So it's about protecting yourself and protecting the rest of the world.
Well, Dr. Coker, as we wind down on this conversation, first, let me wish you Happy International Women's Day. And interestingly, the theme for this year is Women in Leadership, of which, of course, you are one of them. And I'd just like you to touch on this. The theme is Achieving an Equal Future in a COVID-19 World. And, of course, we're meant to celebrate the tremendous efforts of women and girls around the world in shaping a more equal future and recovery from COVID-19, which you are playing a major role. But, I mean, you have worked in government and in other spheres. Just what more can be done to ensure this equality?
I think it's multifaceted. It starts from the home. I think parents should encourage their daughters to be bold, to embrace leadership from youth. That's the influence I had. My father was always behind me, and, egging me on to do the best I can and embrace leadership whenever the opportunity arises. And we also have to prepare them. There's that thinking that women can do certain jobs, they can't do certain jobs. There's a lot of research out there that says a woman is less likely to go for a job that she's qualified for, whereas a man is more likely to go for a job that he's not qualified for. So women have to step up to the plate and be bold. Also, there should be legislation to encourage female participation in leadership. It has to be, proactiveness in the government, every layer, every facet of the society, just ensuring that when there is an opportunity that women are included. There is the issue of the family life, but that concession should be given. Man is more likely to move around, from one job to the other, happy to, go to another country, whereas the experience of a woman might be limited because of her family life. So that should be taken into consideration when reviewing CVs and thinking of people taking up leadership positions. And yes, we must make room for maternity leaves and things like that. Those are the controversial things that we haven't embraced totally, but I can see that Nigeria is taking steps to addressing those issues, and I'm looking forward to a Nigeria and the world at large of more women leaders.
Yeah, Dr. Koka, we can't even begin to list out all of those things that even as men we think need to be addressed on this matter. But we're taking on the International Women's Day next after this break. But we want to thank you very much for your time and thoughts and wish you all the best in this rollout of COVID-19 vaccines in Ogun State.
Thank you very much, gentlemen, and happy International Women's Day to all the women out there.
All right, we're back in a moment. Stay with us.